2 weeks ago, the great state of Louisiana had 0 confirmed cases of COVID-19. Now, according to a new study by the University of Louisiana, the number of cases in that state has risen faster than anywhere else known in the world. Louisiana has gone from 0 cases to 1,388 cases in 2 weeks. The New Orleans metropolitan area now has more cases than Los Angeles County, which has a population 26 times as large as New Orleans. The governor of Louisiana, John Bel Edwards, is asking for a federal disaster declaration, warning now that per state projections in New Orleans, the current projections of hospitalization significantly exceed capacity beginning on April 4th, which means New Orleans won't be able to continue to provide hospital care at the end of next week. Some Louisiana officials say that Mardi Gras celebrations last month may have been sort of a virological accelerant in Louisiana when 1.4 million people flooded into the city to party and parade through the streets at a time we now know coronavirus was spreading in the United States. Among doctors worried that Mardi Gras in New Orleans this year may have been that kind of a problem is Dr. Rebekah Gee. She, until recently, was the head of the state's health department. She's now CEO of LSU Healthcare Services. Dr. Gee joins us now from Louisiana. Doctor, I appreciate you making time tonight. Thank you.
Good to be with you.
What do you make of the governor's stark projection that in New Orleans, at least, hospital capacity may be overtopped by the end of next week?
Yeah, Rachel, as you just mentioned, Mardi Gras was the perfect storm for spread of this virus. We now know that this virus is incredibly infectious. You can get it not just from coughing or sneezing on someone, but breathing or standing next to them. Not only did we have people in floats, but people in parties, people from all over the world came here. And we now know that people who came here and then left from here have now spread the virus to other parts. So we have documentation that the virus was here at that time. And unfortunately, people were throwing beads, sharing drinks, and they weren't only throwing beads, but likely throwing COVID-19, and people were catching that as they came here for the celebration. So because of that, we have the worst problem in terms of the number of cases moving fast at 68% nearly increase in 2 weeks, which is higher than LA and higher than Italy. And so the projections are real projections based on the experience of other places and need to be taken seriously.
How would you assess the hospital capacity in Louisiana? Louisiana is not a wealthy state. You head up one of the flagship university health system in the state. You're former secretary of the Louisiana Health Department. What should we understand around the country if Louisiana does have a rapidly increasing epidemic that's already of considerable size? How much capacity is there in the state to continue to care for people while the number of patients rise?
So right now, our hospitals are about 50% capacity, and we estimate that we have about 380 additional ICU beds. Systems like Oxford and LCMC are trying to build capacity, and certainly bed capacity and the availability of ventilators is a problem, but we're also really worried about staff. We only have a certain number of pulmonologists, critical care nurses, and so on in the state of Louisiana, and we don't have enough of those to meet the need that we're going to have when this surges, which will be in approximately 2 weeks, or when the governor said in early April, when we're going to run out of bed capacity. And so that's why the major declaration of disaster is so important that California and New York and Washington have received, so that we can start to get federal assets deployed here. We simply don't have enough here. Now, Louisiana does have a lot of healthcare assets. They're mostly in southern Louisiana, which is bad when you have a hurricane season and you have a storm coming to hit you, but good in this case because they are located near where the people who are getting sick are, which is in the greater New Orleans area. Of course, elsewhere in Louisiana, people are sick, but the majority here, again, because of Mardi Gras.
In terms of staffing, we reached out to a number of nurses today in Louisiana trying to get our heads around what's happening, what the ground truth is in New Orleans Hospital. We started hearing anecdotally about reports already about there not being enough protective equipment, about nurses not having access to enough masks, about nurses being worried about not being able to protect themselves and potentially bringing this home to their families. Do you feel like the state has a handle on how to get after some of those problems that are already manifesting in emergency rooms and wards around the state?
Well, this is a big problem, and it really is a supply chain issue. And I spoke with Senator Cassidy about this evening. The fact that normally you have supply chain from China that allows hospitals to get what they need, but now is disrupted because you have individuals who are price gouging, buying up hundreds of thousands or 1 million masks in one case last week. Much of which I spent sourcing masks, and that disrupts the ability of normal supply chain. That being said, people are resorting in New Orleans now to making masks in a furniture store, Goodwood Furniture. We're using 3D printers to print face screens. And right now, things are okay, but the estimates are that we're about 4 to 5 days in some systems from being out of personal protective equipment. And today, people are reusing their personal protective equipment, PPE or masks, being instructed to, in some settings, put them in a paper bag at the end of the day and reuse it the next day. And that would never happen in normal conditions.
Dr. Rebekah Gee, CEO of LSU Healthcare Services, until recently Secretary of Louisiana Health Department. Thank you for joining us. Keep us apprised, Doctor. Thank you.
Thank you.